All right, so I do have closed captioning on for those who do need it, and it will be recorded, so that way we can put it on the website. And then for those that need to review afterwards. So thank you all today for joining us for this webinar with Ashleigh Hala today. She joins us from Massachusetts College of Liberal Arts and has had a background with different varieties of prevention and substance misuse. So we are looking forward to hearing what she has to say today for AOD prevention on a budget, what it means to, plan effective evidence-based strategies, maybe when you have a reduced budget or limited staffing, and how to increase your capacity. So for those of you who do need that CEU credit, as I put in the chat, I will be sending out an eval form after this webinar. And then I will get some certificates sent out to you, hopefully by the end of the week. So I'm going to turn it over to Ashleigh just for the sake of time, and we'll get going.
Sure. Thank you so much. Happy to have folks online today. Really excited to chat with all of you about this. And thanks for being here. So I'm Ashleigh Hala. I'm an Associate Dean and Chief Wellness Officer at Massachusetts College of Liberal Arts. I kind of came up through higher education 15 years ago through health promotion and prevention work. I'm also a licensed therapist, so I do some of that work as well. Currently have oversight for a comprehensive health and well-being portfolio, AOD work being a piece of that. So I'm excited to be here today. My hope is to give you some tangible things that you can take with you to your campus communities, and we'll see what happens. Okay, so the agenda for today, we'll talk just for a moment about kind of the costs of this, right? Because it's not just a matter of what we do from an intervention perspective, but substance misuse actually costs us money. So let's talk about that. We'll do a little bit of a dive into prevention practices. Then we'll look at some different strategies that you can use, again, all at low or no cost. We'll talk for a second about strategy, a little bit about creative funding, and then hopefully there'll be a few minutes for questions. So I want to start here. I want to just acknowledge that funding over the past 5 years, 10 years in higher education has been really sporadic. There have been times when I've seen institutions, private or public, sort of see a surge in funding particularly as it relates to wellness-related issues. And there are times when I've seen big dips. COVID-19 really impacted the way that we look at our operational budgets, right? And so, the numbers that we're actually working with are changing. And yet, while we are seeing some longitudinal, differences, we are still challenged on the college campus level when we think about our student substance use. And so we are being asked to continually meet this bar of making sure that our students are as safe and as healthy and as well as they can be in regards to substances, with budgets that keep getting cut and cut and cut and cut. And so I want to just acknowledge the reality of this, but also, again, kind of leave you with some hope today around some things that you can do that are going to have high impact on your students' substance use that hopefully don't cost you, some of them, even a penny. So I want to just, again, sort of have this acknowledgement, use it as a framework, and sort of take it through the rest of the presentation. So like I said, there is a cost to this work as well. It's not just programmatic implications for us. There's cost to the use itself. And so you'll see here a little bit of data around what this actually has cost in the United States, due to a study from 2000. So we're looking at billions of dollars when it comes to alcohol, tobacco, and other drug use. And so it's important for us to acknowledge, hey, the investment in prevention matters. There is a fiscal piece to why prevention makes sense. And you can see here, this is from a report published by SAMHSA. There are different things that where these billions of dollars come from, right? Where these costs come from. And so we're looking at things like treatment services. We're looking at criminal justice systems and resources related to those types of things that might be happening due to substance use. We're looking at work loss. Like we're looking at these different kinds of productivity costs and resource costs that are causing us to say, hey, substance use is presenting this issue, and hopefully prevention is the key. Now, there's been some interesting, research done on so what are the best and most effective kind of avenues for prevention around substance use. And when it comes to working with youth, the school-based programs are actually one of the most effective. And so being able to produce a prevention program within the confines, within the boundaries of a school setting has a high impact on the youth that are engaged in that school setting itself. And so you'll see here that when these school-based programs were implemented based on a study by Grant and Dawson and Linsky, percentages of decrease in binge drinking, cannabis use, cocaine use, and smoking regularly. And so, just something for us to consider and say, hey, we've got this sort of pivotal resource in being a campus, in being a school-based environment. How can we leverage that in the work that we do? And again, here, that report from Sam. So this just shows you a little bit about what those numbers look like from a low, medium, and high estimate perspective of substance use delays or prevention work. So I'll give you just a minute there. Okay. So just sort of wrapping up this idea of the cost of substance use. When we look at school-based effective programming, and we'll talk about effective programming in just a second, there is significant fiscal impact. And so it's saving billions of dollars as opposed to costing billions of dollars within a short time frame, within 2 years, 1.3 billion and 1.05 billion in 2 years of educational costs. That's really significant. Medical care, with thinking about resources and productivity, that when we looked at that graph before, $33.5 billion. And then we will also look at the overall quality of life. And so this is something worth investing in. And the reason that I show you this is, while we have maybe this lack of operational funds to do this work, we should always be striving for more, right? We should always be asking for more money. I think we should get t-shirts in higher ed that say that, always be asking for more money. And we need a narrative, right? And part of the narrative around AOD is that there is a cost to the use itself. And so how do we leverage prevention to help bridge that gap? So I want to just talk just a couple slides on thinking about best practices in prevention work, because it's going to influence the way that we talk about this during the rest of the presentation. So some of you might be familiar with things like tertiary and primary prevention and that type of terminology. What we're actually seeing in the past 10 years or so is moving towards this language that you see here. This is the prevention protractor from, or the IOM protractor from the Institute of Medicine, rather. And what it shows is let's say a student's full experience with the healthcare system, right? So let's break this down. So the sort of triangles in the white, those are going to be your direct services. So it starts with case identification, meaning a diagnosis of some kind, then standard treatment. So you've got the diagnosis first, and then a treatment is deployed. Then compliance with the treatment, right? So the student has to say, yes, I will engage. And then aftercare once that issue is resolved. And that can certainly, present itself around a substance use issue, right? There can be an official diagnosis, standard treatment, compliance, and recovery, really aftercare and recovery. It can also be, I imagine you can sort of think about many different scenarios where these 4 sort of stages make good sense. Thinking about sexual health as an example, thinking about the flu as an example, right? Like there's ways we can sort of see how somebody might walk through these stages. Now, the part that I really want to get to is the blue. And what we think about here is prevention and promotion. So just to differentiate them, the way that I like to say this is prevention is making bad things happen less. and promotion is making good things happen more. And I know it's more complicated than that, but often when I try to sort of demonstrate these different strategies and approaches to folks around me, it's usually sort of how I try to frame it for folks who maybe don't have prevention or health promotion experience. So what you'll see here is that there's 3 light blue triangles and 1 darker blue triangle. So the 3 light blue triangles, what you'll see is universal, selective, and indicated. And we'll go sort of from the middle to the end here. So an indicated prevention strategy, what that is a prevention strategy targeted at an individual before there's a diagnosis of any kind, which would be the case identification, right? So a great example of an indicated prevention strategy is basics, a motivational interviewing intervention. There's no diagnosis there, but it is absolutely a prevention and mitigation strategy, right? So great example there. Selective being that second blue triangle. This is a prevention strategy at a group that might be at higher risk. So the literature tells us, as an example, that student athletes have higher rates of binge drinking than non-student athletes. So what might we do to create a prevention or intervention strategy that directly impacts that group of students, given the context, right? So that's selective. And universal is a prevention strategy that applies to everyone. So that might be an amnesty policy, right, within your codes of conduct, something that every single community member has access to, regardless of what groups they belong to, regardless of their class year, regardless of whether they're a user or not. Like they have access to this prevention strategy, right? So that's that example. And then again, promotion sort of rounds us out here. So that again is, how do we take the good things, the protective factors, the things that help our students stay safe, healthy, and well, and how do we make those more present for our students? And we're going to see some of those examples as we move on. And the other thing that I wanted to introduce you to is there's this really fabulous article by Nation. And what it does is it breaks down what an effective prevention program needs. And one of the reasons I love this is, there's it depends on what we're looking at in higher education, as far as what, we're trying to impact, right? So substance use, sexual violence, maybe sexual health or mental health related things. It's a wide variety. And in some of those areas, there's more literature, and in some of those areas, there's less. And so what I really appreciate about this model is it says, hey, let's say that you're in the position to do something new. Let's say that you are building and creating a brand new prevention program, intervention, strategy, approach, whatever you want to call it. Here's what it needs to look like. Here are the steps you need to take. So just to sort of go over this briefly. So the first piece is that if you're implementing a prevention strategy, it should be comprehensive. And so thinking about all of the domains that might be influencing our students' development and their behavior. So examples they give here are things like family, peers, community, etc. There should be varied teaching methods. And so, thinking about different ways that people learn. And so should all of our prevention strategies be online modules? No. Should they all be in-person workshops? No. Let's think about ways that we can teach in a varied way. Sufficient dosage. I love this one. I can almost guarantee that a lot of you on this call can attest to the fact that our first year students know all the stuff, right? Like they are an easy group to sort of get together. It's an opportunity at orientation to get maybe some AOD programming out there. So our first years have a general understanding of maybe campus culture, maybe basic skills training or things like that. But then what I often see on campuses is this dramatic drop off. We see our sophomores and our juniors and our seniors not having access to the same types of education, or even like a sense of tiered education, right? Like, all right, you did this thing at orientation. How do we take this up a level or up a level? And so sufficient dosage really allows us to say, how do we continue the conversation? And I think we're so poised for this in higher education because of the design of curriculum. This is exactly what we do, is we say, here's this thing we want you to get really good at. And here's how we're going to break it down over a 4-year experience. We can think about prevention in the same way, right? Prevention should be theory driven. So we have to be grounded to something. I have a colleague who calls it being tethered and relates it to a hot air balloon being tethered to the ground. Like you're still out there floating, but there's something holding you there. And so there's got to be some kind of theory that brings us there. It should center positive relationships. So we know that role modeling and relationships are a protective factor, and having a strong sense of community is a protective factor. And so how can we build positive relationships into the prevention program itself? Role modeling is a great example. Using peer educators is a great example. Those types of things that you center the relationship as a piece of the intervention. Appropriately timed. So I want you to think about your campus community. I want you to think about moments in your calendar year that are higher risk moments than others, right? So I used to work at an institution where alumni weekend was a high risk weekend. Lots of alumni would come back to campus. A lot of day parties would happen, and we would see people drinking much earlier than normal and much more than normal. And then we'd also have all these people on campus who aren't our students anymore, right? And so when we thought about a comprehensive AOD strategy, like we had to be really thoughtful about, hey, this moment on our calendar needs specific attention. And so figure out what those are for you and appropriately time some of your initiatives. We should be socioculturally relevant, right? I mean, when we think about some best practices, and we're going to talk through some of this a little bit as we move forward, who were those best practices designed for and around? And how might we change our approach to be socioculturally relevant to the many different types of students that we have on our campuses, and making sure that we're not just programming or planning for the typical student, right? We are thinking about this in a disaggregated way, looking at those different communities and how they interact with substance use. Again, going back to that selective intervention model. There should always be an evaluation or assessment process in any sort of public health initiative, right? We should make sure that we are assessing, and we'll talk a little bit more about that. And then well-trained staff. So we want to make sure that when our students have questions or concerns, there are people that they can go to who know their stuff. And so investing in our staff's professional development is a huge step in investing in prevention. So what I'm going to do is I'm going to break this down into 3 parts. The first is going to be individual, or again, those indicated strategies. Then we're going to look at community or selective strategies. Then we're going to close out with environmental or universal strategies. We'll walk through them. I'll give you some examples. I'll let you know sort of what I'm thinking as far as what the investment might be in some of these things. And again, this is the part of the presentation where I hope you can write a few things down, find maybe, in these next few slides, a couple of easy wins, some things that you can do on your campuses that are very low or no cost that are going to have an impact on your students' substance use. So that's my hope for the next couple of slides. So looking at those individual strategies, a really easy one is a PFI, so a feedback report. You can build these. You can purchase these through different companies that have surveys that give students that personalized feedback. But you can also build your own. I've done them on Qualtrics, where we build the survey, the PFI itself. It creates this sort of page that it spits back to the students, depending on what they selected in certain questions and categories. And it was totally homegrown, and it was using the best practices of what a PFI needs to look like and the information that we need to have there. But if you can't access some of these larger, maybe more expensive services, you can, whatever you use on your campus, SurveyMonkey, Qualtrics, you can build that PFI yourself. And so that's definitely an easy win for thinking about how we can impact an individual's use. Then there's skills training, right? So, how can we introduce individuals to basic skills around drinking or other drug use? And so, looking at BAC, looking at drink pours and thinking about standard drink sizes. Like these are the types of things that we can use to help work with individuals around making the healthiest choices that they can around their use. Basics we already talked about, so a motivational interviewing approach again sits nicely in that indicated section of that protractor. Now there is software out there that you can purchase that helps frame a basics intervention, but you don't need it. You don't need it to do the work. What you need is the actual motivational interviewing based intervention itself. The software just makes it easier sometimes, but you can build those things out as far as what you need to help keep track of cases, as an example, or you've built out that PFI, make sure know who's filled it out or who hasn't. We can build systems internally for those things if getting the software is not on the table for an intervention like basics. Another thing that I'm a huge proponent of is universal screenings. And I actually think about universal screenings not just for substance use, but I would also think about this from a suicide prevention perspective and from a sexual violence perspective. And so when we think about universal screenings, I want you to think about the spaces and places where our students spend the most time, but are also maybe vulnerable or looking for health information. And so what comes up for me would be our health services, our clinics, our athletic trainers, our counseling offices, maybe basic needs spaces, right? Our chaplains. These could all be great examples. And a universal screening essentially is you come in, you have an appointment at the health center because you sprained your ankle. Well, before you go in for your appointment where they sprain your ankle, you get, either a piece of paper or an iPad or something that asks you a 10-question screening, and you're able to sort of go in and sort of say, here's kind of where I'm at, maybe a couple questions on substance use, maybe a couple on mental health, a couple on maybe dating or domestic violence. And then the provider gets those responses and can immediately make a referral if needed, right? But the other piece, though, is that there's an educational component to this. When students see the questions and have to interact with them, it does teach them something. It teaches them a few things. It teaches them, one, that the institution cares enough to ask these questions. And two, maybe it helps them identify problematic behavior, right? Like I had a student once who didn't know what binge drinking was until we asked, do you drink more than 5 or 6 drinks, like in a sitting or setting? And they were like, whoa, like I thought in their mind, like a binge drinker drank like 12, 15, like they just drank more than they thought. And so this was a moment of education, which I think was really smart. And then recovery resources too. I know that this falls into that sort of other end of the protractor, but having sort of the public facing, non-stigmatized recovery resources, whether you're able to provide them on your campus or you help to connect people to community resources, being able to just say like, hey, recovery is normal. Like this is a thing that we talk about here. And this could be, again, maybe you have your own campus recovery group, or maybe you just very purposefully have brochures for other recovery spaces in places that maybe that are doing these universal screenings. It just shows that like this is possible. It could be a part of your journey, and it's normal and something we're okay to talk about. So those, I think, are some easy wins as far as how we impact the behavior of individuals, and really, honestly, not a lot of cash spent here doing those types of things. So those are some individual strategies. Then we think about our communities, right? So again, low to no cost. So the first is going to be access to food. Now, I've been in higher ed for 15 years. When I do an event, food always costs me the most money of the whole thing. And so there are ways to give our students access to food that are very costly, right? But I want to get creative about this. And so a couple of examples. Access to food could mean a basic needs approach. And so something like a food pantry. Access to food could mean the dining hall being open later. So maybe closer to the hours when students may be drinking. Maybe we advocate that food is available later, food that they can use a swipe for as opposed to cash that they might need to pay for. I would suggest something like partnerships, and we'll talk about this in the next slide, but partnerships with local restaurants and bars to offer maybe coupons for your students on Thursday, Friday, and Saturday nights, right? There are ways that we can think about getting food into the bodies of our students that don't actually require us or the students themselves to put out a lot of money. So just something to think about. Social host training, thinking about who's hosting the parties on campus. I've been on campuses where it was the athletes. I've been on campuses where it was fraternity and sorority life. I've been on campuses where, it was different other types of groups as well. And we wanted to make sure that we sort of knew who the influencers were, and B, that we trained them in social host stuff. And so that is inclusive of everything from, sort of alcohol safety and skills to maybe some stuff around policy, which we'll get to in a minute, to bystander intervention, right? Like all of that stuff kind of wrapped up in making sure that these people who are creating social experiences for our students know how to keep people safe in their spaces. So that's a big one. That again, getting a group of people together and putting a PowerPoint and maybe doing some skills-based stuff, not going to cost you a lot. I want you to think about your sporting events and tailgates, for those of you who have those on your campuses. I remember when I was talking before about appropriately timed, these can be high risk events and moments if alcohol is permitted. And so think about ways that we can influence that tailgate process. And so, there are lots of different things that maybe we could do that that are not going to sort of break our budget. And so thinking again about food, or is there a partnership with the venue to help provide more food to our students? Could we get donations for water, so that students actually have access to water throughout the tailgate? They don't have to pay for it. They can just pick up a bottle of water whenever they need it. It could be something like increased community policing, right? Making sure that we see more folks out there who, so our students can have a sense of like feeling safe and secure in these spaces, right? It could be, having people, I know that at a campus that I worked at before, they would bus students from campus to the sporting venue. What does it look like for folks helping people onto the bus, like, and being able to identify students who might need some assistance, right? And so getting creative about ways to make those events safer. Social norms campaigns. So we know from literature that social norms campaigns can be incredibly powerful when it comes to changing perspectives around substance use. All you need to do with this is you need some data. Now, there are some really expensive ways to get data, right? Like there are some big surveys that are common within college health that cost a pretty penny to deploy on our campuses, and some of us do those, some of us don't. And if you have that data, absolutely use it. But if you don't have access to that, like financially, you don't have access to that, again, build your own survey. Use other tools around you to help build something with efficacy, but like build something that you can commit to, that you can use more than once, that you can use to track data over time, and then take normative sort of statements and behaviors from that survey itself, and then create something like a poster campaign, right? So really what we're looking at here is the cost of printing, maybe 100 posters that go around your campus that, again, have a chance at pretty high impact. Talked a little bit about this, but bystander intervention is a great place to go. A couple of things I'll say about bystander intervention. One is there are 20 or 30 kind of boxed programs that you have access to. Some are more expensive than others. It really depends on what you're looking for. But also, I was at a campus where we built our own homegrown. We looked at the 20 or 30 to see what our students were most drawn to, or maybe what didn't quite, hit the mark for them. But we built a totally homegrown bystander intervention program. I will say that we did get some grant support for that. It wasn't a huge dollar amount, but it did help, maybe hire some students to move this project forward. And so we'll talk about some funding sources opportunities, but getting a bystander intervention program running is a critical piece of this too. Substance-free programming. So if you've already got programming happening on campus, I want you to connect with your student activities colleagues, your student government colleagues, your campus union colleagues. And I want you to take a look, because here's my guess, is that they probably have a pretty good idea. If you were to say, what are the programs in the fall? What are the big programs in the fall? They probably have a good sense of what that calendar looks like. And how powerful would it be to pick 5 and say, these are substance-free? And you have it on the advertisement. This is a substance-free program. Even just seeing that goes back to that universal idea. Even just seeing that helps students understand and appreciate the role that alcohol plays in this community, right? And so think about programming options and where you can partner as well. One thing I've done at another institution is called a party grant program. Now this does cost, but we can hopefully keep it at low cost. And really what we did was, this wasn't a party registry, but people who were having a party, and honestly, we got everything from like wine and cheese nights to much bigger party, like costume parties, like it was everything in between. They would apply for money for food and water. And what we would do is a couple things. We would get the water actually donated from our dining services. So that was at no cost to us. We'd usually have a cap around food, so maybe like $50 or something like that, just to get something into these spaces, to get some food into these spaces. But where we spent a little bit of money is we had some sort of marketing things that we included in the kits themselves. So as an example, we had napkins that had bystander intervention information on them, plates with things with comments around alcohol safety. One of my favorites was when I was at this institution, I oversaw the sexual violence unit, and we launched our first sexual assault related hotline that the college ran in-house. And it was not hard to sort of figure out how to get people to know about it, but we wanted people to have access to it when they needed it. And so what we ended up doing was we had these lifesavers, these mints, and we put hotline messaging on them, and they would go in every kit. And what I loved about that was it's not abnormal to take a thing of lifesavers and just put it in your pocket. That's there, that's cool. And so we saw some real popularity there. Certainly the hotline got calls, trust me, I was on the other end. And so just ways to think creatively about how when you have something like a party grant program, how can you get as much in there as possible? A few years into the program, we started including things like condoms, and we put stickers on the condoms about consent, right? Like how can we hit as many of these topics as we can, keeping that cost as low as possible. Think about ride shares. And I've seen some creative partnerships with folks. I've seen programs around getting like vouchers for either taxis or Ubers or Lyfts for students if they might need those to stay safe. I've also seen partnerships around sort of the institution providing some education for folks around, like, hey, if you see a student and they are sort of displaying these types of behaviors, here's what might be helpful for them in that moment, right? So just think about ride shares as a potential way to help keep our students safe at that community level. I can't underscore this next one enough. Partner with parents and families. And this is a great opportunity for that like orientation moment, but also throughout the student's college experience. You know, one thing that I often do when I talk to students, when I talk to parents at orientation, and they, you know, I usually get some kind of question on a panel that's like, well, what's one thing you want parents to know, right? And I usually say, talk to your kids about sex, drugs, and rock and roll, and talk to them so that they hear it from you, because they're going to hear it from us. And I really want this not to be the first time they hear it. I want them to hear it from you. And, you know, I know, like, I hope that we can build resources and have peer educators and staff that are really welcoming and open and are able to help your student. But like, I also know that they're going to call you, like, if something happens. And so I want you as a parent or family member to feel prepared to have hard conversations. And so what can my job look like in helping you do that? And so things like parent newsletters, or some people have designated parent orientation sessions. I would always do an alcohol and drug and sexual violence session with folks, and really sort of tailored it to, all right, here's kind of where we are on the college landscape, and here's how you can help. And I think that there's a lot of appreciation for partnership there. Enhanced community policing, we talked about this a little bit before. You know, being able to show our communities that we have people on campus whose sole job is to keep us safe. You know, I think that I put community policing in because I think that the people matter. But other ways that I've seen this implemented that have kind of a similar impact is the increase of like police cars sort of going around campus or parked around campus. Students tend to sort of think, oh, hey, I'm going to think about sort of my surroundings differently. I'm going to think about, you know, whatever. And then this is totally not a low cost option, but one other one that I've seen is like increased cameras or increased lighting around communities as well, that sort of, again, signal to our students that they're in a more safe and secure environment, but also there are things that are being put in place that might discourage behaviors that we want to see less of. So that's just an example there. Drug disposal is a great community approach. Usually you can partner with a police station to do this, and so or a medical provider. Honestly, in my experience, they give you a box, you have a day, maybe somebody shows up, like a police officer as an example. People get rid of old medication and then they move on. Shouldn't cost you anything, should be able to just, you know, make an impact on your campus community in an afternoon. So an option there. And then screening days. Now, for this one, you can have a screening day that costs you $10,000. Absolutely, right? Giveaways, food, prizes, you know, entertainment. Like, I mean, we could go full on the gas for a screening day. Or you could get a survey that you build, again, that PFI that you probably already built for your students. You could have, you know, a tent outside, or you're in a comfortable place in the quad or someplace where you get a lot of students. And you make it so the survey is, you know, 2-3 minutes. Hey, do you have 2-3 minutes for me just to help gather some information? And just get survey after survey after survey. And then what you'll be able to do is look at numbers and see, like, this is what we're seeing at a community level, as opposed to those individual PFIs that you were doing before. And so a screening day can be anywhere on the spectrum. We can do it cheap, real cheap and real on a budget, or it can be a blowout event. It really depends, but I think they're worth it either way. And then it's also really important that we focus on our environment, right? Like, we know, particularly from a health promotion perspective, that we need to be looking at systems and settings. And so using universal strategies and environmental strategies is an important piece of that. So I wanted to give you a couple of those too. The first one feels a little controversial to me, actually, which is enforce the 21-year-old drinking age. You know, I've worked on many campuses in my career, and I feel like, you know, we're an institution of learning, right? And so our default is to teach, is to educate. And so I think we need to find a happy medium between our calling to educate and this enforcement of the drinking age, right? Because, you know, I'm not necessarily, you know, suggesting that every underage drinking student gets arrested by campus police. But I am suggesting that the campus community does take the 21-year-old drinking age seriously in a way that makes sense for you. And so enforce it in a way that makes sense for your culture and your community. If you sell alcohol on your campus, I've worked on one campus that had, two campuses that had bars or pubs. And just be thoughtful about when alcohol can be sold. Think about the days, think about the hours, how late, make sure that if you're serving alcohol, the kitchen's still open and you're able to make food, those types of decisions from an environmental perspective. This is probably something you're doing anyway, but a yearly review of your alcohol and drug policies is another great prevention strategy. Get a cross-disciplinary group together, folks who have a stake in this. Get public safety in the room, get conduct in the room, get fraternity and sorority life in the room, whoever it is that you feel like you need, and review that policy again and say, what did we learn from this past year that we can think about differently now that we've had this experience? Or, can we just affirm that we've got the right stuff on paper, and let's keep letting it work, right? So just another way to literally just have a meeting and get that done. And that policy review should include amnesty policies. And the one point that I want to make about these, well, actually the 2 points that I want to make about these, one is that you should have an individual and an organizational amnesty policy, meaning that a person can receive amnesty and an organization can receive amnesty. And so if you don't have those, think about it. Think about what might be possible for you. And then the other thing I'm going to say about amnesty policies is I think more and more institutions are putting them in place. We've definitely seen a surgence in this, but I think that there's this missing piece of students really knowing and understanding what it means. And so when I talk about amnesty policies, it is almost as important, if not more important, to be able to market the policy as it is to write it in the first place. And so you really want to make sure that students know what it is, know what to expect, and that it feels accessible to them. Because if they either don't know about it, or they're like, yeah, that's not a real thing, like that's not how, that's not how the college is going to respond, no one is ever going to use it. So if you're on a campus and you have an amnesty policy and no one uses it, we need to have a conversation about what to do next, right? So that's a great environmental strategy as well. We talked a little bit about this, but partnerships with local restaurants, bars, and other agencies. So restaurants and bars. So there's a couple things you can do here. Again, maybe coupons for students on Thursday, Friday, or Saturday nights. You could also get your health promotion AOD wellness staff over there to do some training around campus resources or around what does alcohol poisoning look like, or whatever might feel relevant. You could also ask them if there's items that you can put in their space. And so I think my favorite is like a poster on the bathroom door, right? And being able to say, hey, here's what you do if you need a ride home and you don't have money, like here's that ride share partnership, right? Here's public safety's number if you need help. Here's the nearest hospital. Here's I saw one school, they created this phrase that if you said this phrase to the bartender, they would intervene, get you a ride, and they would know that you needed help. And so make partnerships. And then these other agencies that I refer to here, police officers, EMTs, folks that are going to interact with your students regarding their use. Build partnerships and think about ways that you can lean on each other to directly impact your students' experience. Substance-free campus initiatives. So a great example of this is like tobacco-free campuses. I've certainly seen dry campuses as well, and I think that we're in the throes of what cannabis is going to mean for us on campuses. But I think having a substance-free campus, like here where I am currently, it's tobacco-free, and there's signs everywhere that say we're tobacco-free. Again, that's almost like the police cars I was mentioning. Even just having the signs promotes the healthy behavior itself. So those are good places to start as well. This one's my favorite, and this one's the hardest one to get done, but it is my absolute favorite, and that is do what you can to get folks to have classes on Fridays. I have worked at several institutions where Thursday night and Saturday night are like really hard, which makes Friday morning and Sunday morning really difficult for those of us who provide some kind of emergency response. And so when we think about the curriculum and when we think about, again, sort of our role as educators, if we can put classes on Friday mornings through afternoons, and get sort of our faculty and academic affairs folks on board with that, we're going to see impact on our students, in particular drinking, but our students' substance use behavior. And so, you know, I think it's a clever intervention to get to the means to the end here. I'm sure a lot of you already have this one, but making sure you have policies around types and amounts of alcohol permitted, and those are very clear in your policies. Newer though is this trend around alcohol delivery. So, the GoPuff and Postmates and DoorDash, and the opportunities that your students have to get alcohol delivered to them. And to be honest, there are things in place where an ID needs to be scanned, but there are totally ways around it, and fake IDs often pass through. And so think about, well, what does this mean for us, right? The fact that a student can order this much alcohol and have it delivered right to their residence hall door. What does that mean for us as a community, and do we want to do anything about that? And maybe you do and maybe you don't, but I think it's worth the conversation. And then there should be a coalition, right? So one thing I love about coalition work is, I've worked in health and wellness for a long time, and have been convinced that if those of us doing health and wellness work are the only ones focusing on that, we're going to fail. Like, we are not going to succeed in our work. And so if you've got an AOD coordinator, if you've got a health promotion specialist, and they're really taking on this work, if it's them and them alone, you're not going to see the progress you want to see. But when you bring people together, again, campus stakeholders, like some of the ones we mentioned before, some of these local restaurant bar agency representatives, right, bring them all together and say, all right, we've noticed that our students, present in this way. Maybe we see high levels of binge drinking on Thursday nights. What can we as a collective do about that? Very, very powerful. And the other piece of that is shared nomenclature. So you and your campus colleagues and the community programs that you're involved in are all saying things and doing things in the same way, which gives our students a seamless experience. So I want to talk just for a second about strategy. So now that you've got some ideas of things that you might be able to do, how do you put them into place? And so I imagine that many of you are familiar with the NIAAA and College AIM. And so this is a strategy planning worksheet that they offer. It's just on the College AIM website. And it just walks you through thinking about the strategies you have and if it is kind of worth doing. So it asks you to think about your current strategies. So what you're doing, is it individual or environmental? I would add community in there, but that's okay. Thinking about effectiveness, cost, any barriers or reach. And those actually hit on some of those pieces by nation that we introduced earlier. And then next steps. So are there any modifications that we can make to make those ratings any higher, maybe make it more likely for that intervention to work? And then what I love about this sheet is the possible new strategies. I don't know, I can't see who's on this call. I can only see my slides. I don't know how many of you have met me before, but I have a reputation of like high risk, high reward is kind of my approach. And so I'm like game for trying something new. And if I fail beautifully, I fail beautifully. But sometimes there are these big successes and they're worth it. And so I would personally spend a lot of time in this new strategy area, but still using the skills and the tools that College AIM provides to help us, put something together that meets sort of the threshold of a solid prevention program. So just something for you to consider. And before we close out today, I do just want to talk about some ways to get you a little more cash in your pockets. I again want to appreciate that, operational budgets are getting slashed left and right. I put my budget through this year and they said, all right, take 5% off. I was like, okay. And you just have to roll with it. And so what are some other options? So certainly grants, and there are different types of grants out there: federal, state, private, and population-based. And grant writing is tough. I imagine that for most of you, you might actually have a grant writer on your campus. So if you haven't taken them out to lunch yet, like, do that, meet them, chat with them about your needs as it pertains to this particular issue. Grants are really different in how they're like implemented and sort of the requirements of them. Federal grants being the most tedious, and usually private grants being most liberal. There are some really cool population-based grants. One that I do want to call out for all of you is the Choices Grant through the NCAA. It's meant to look at substance use in student athletes. And I've had the pleasure of receiving a Choices grant, and it was a game changer for our athletic community. So just one example of what that might look like. Partner with advancement. Again, this is another one. If you haven't taken your advancement folks out to lunch, do this one too. You may very well be able to craft series of programs that really speaks to a donor, an alumni, somebody who's invested in your regional area, somebody who has some connection to the work that you're doing on your campus, who maybe lost a family member to substance use, or maybe they're in recovery and they want to see some of these pieces for students. Like these people are out there, and so I want you to have at the ready your dream, right? If I could do everything I wanted to do, here's what it would cost. And then share that with your advancement folks, because you never know who's going to come through the door. Leverage student organizations and student activities. So I imagine that a lot of you have student activities fees that pay for all the big events that happen on campus. So how can we get in on that a little bit, right? Again, that substance-free programming idea is one example of ways that we can kind of sneak in to a couple of spaces and places. But does it make sense to start a student organization around health and wellness? Does it make sense to what are ways we can tap into those funds, because they're usually pretty significant, and use that to bolster our programming? And so just something to consider there. Compliance. I'm a huge fan of required stuff. I know that not everybody is, but like I am a huge fan of required stuff. I think it gets people in the room, and you need to be a good steward of that time as a presenter or whatever you're doing. But think about different compliance opportunities that you might have. So how can you think about Title IX work and all those presentations that they have to do, and slipping in some substance use stuff, some pieces in there about maybe incapacity or things that we can sort of make sure we're introducing our students to some basic AOD information within this presentation that they are already required to go to. Another great compliance opportunity is fraternity and sorority life. A lot of chapters are required to do some like health and safety programming, and so come up with something that meets their needs, and they will come to you every year and say, hey, can you do that training for us again? And like, yeah, absolutely. And then you're hitting probably a significant number of students. And then, like I said, always chase more money. Like always do it. And assessment is going to be your key to this. Be able to make the case for more operational dollars. And so whatever assessment you build, it could be that PFI, it could be what you use during your screening days, it could be what you use for that social norms campaign. Use it for a little while, gather some data over time, and be able to show trends and say, listen, here are the trends we're seeing around drinking, right? Here are the trends we're seeing when we provide an intervention. And here's what it could look like if we could do more. And if you can create that story and become a storyteller through all of these things, my hope is that maybe you'd have a chance at some operational dollars. So I know we have just a few minutes left, but I was excited to share with you some of these things that, again, I really hope you can just take away with you. I go to a lot of presentations where we talk a lot about theory and perspective, and they don't actually tell you like how to do the thing. And I really feel strongly about telling you how to do the thing. And so I hope that has rung true for you today. I'm going to stop sharing. I'll see if there's any questions, and here to stick around if anybody has anything come up.
And I was gonna mention too, we've got webinars from Jason Kilmer that talk about, you know, some of these strategies in more detail, as well as the College AIM tool that Ashleigh was mentioning. So it can give you a more in-depth way to walk through some of those and just build upon the conversation. And then those for asking about the evaluation, I'm gonna do that today. So I'm gonna pull the attendance list from this webinar and then we'll move forward that way. Anybody else have questions? Yes, for Ches, I've got that included.